So, the way that a mammal, and most things with lungs actually, are able to ventilate them is through the use of a very large muscle called the diaphragm. And the lungs can change the volume, a lot like a bellows for a fireplace or an accordion. When you pull the accordion out, it sucks in air. When you push it out, when you push it back, it's pushing out the air that makes the noise of the accordion. But with us, we have a diaphragm that relaxes and reduces our lung capacity, that pushes out air. When we contract our diaphragm, we are breathing in. It feels like we're actively breathing in, but we're not really actively breathing in. We're just changing and increasing the volume of our lungs. And as the volume increases, it creates a vacuum that pulls that air into our bodies. People that had polio once upon a time would get this big muscle diaphragm, unfortunately, paralyzed. And so instead of having the diaphragm change the pressure on the lung to increase and decrease its volume, they would have to be in what's called an iron lung, which would do that same kind of pushing and pulling to change the volume of the lungs. There's actually some kinds of venom out there. I think it's snake venom. I think rattlesnake actually starts to paralyze you, and if it gets up to your diaphragm, obviously it'll stop you from breathing. But you can do CPR to sort of keep that change and force that change in volume until somebody gets the anti-venom to you. Okay. Any questions? Yes.
You said when your diaphragm contracts, you breathe out, or when it contracts, you exhale, or you contract?
Let's see. When it contracts, it's flattening out. When it's relaxed, it's curved. So when it's curved, your lungs are smaller, get smaller when you breathe out. So that pushes the air out. When the diaphragm contracts, it flattens out, increasing the volume of your lungs, causing a vacuum that pulls air into your lungs. Make sense? Okay. More complex animals have either open or closed circulatory systems. And these systems are both are made up of three basic components. Some kind of fluid, either blood or hemolymph, some kind of tubes, which are blood vessels, they're what's called blood vessels, and some kind of pump called the heart. So that pumps all the fluid around to the rest of the body. So the difference between the two. Open circulatory systems are found in insects, other arthropods, most mollusks except what? Anybody remember? What class? Cephalopoda. Very good. So basically the components of an open system, instead of blood, they have what's called hemolymph. But it's not blood like we think of. If you ever squished an insect, you might have noticed that the color of their blood is often has a greenish tinge to it or a yellowish tinge to it. metal that binds to the oxygen is different than the metal that binds to the oxygen in red blood. In red blood, we get iron binds to oxygen in closed systems. In green blood, it's copper. So insects actually have, as you remember, there's insects and arthropods, right, and other arthropods and mollusks. They have a true coelom, but they have a second cavity called a hemocoel. Okay, and the hemocoel is is filled with blood, special insect blood with copper in it, plus the interstitial fluid, which is just other fluid that occurs in the body. And the blood and the interstitial fluid are all mixed up in the hemocoel. And this blood and interstitial fluid is called hemolymph. And I have a picture of what happens. The open circulatory system has heart and some blood vessels, but the vessels just open out into this hemocoel. So that the blood will pump it in and pump it around the hemocoel back into the tubes that, small vessels that then go to the heart. In a closed system, blood is confined to the vessels. And so that's why we have these in closed systems, that's why we have the capillary nets, because they get smaller and smaller. They're small enough that the gas exchange can actually diffuse across these capillaries. And so the blood is all confined to the vessels. And closed systems have an interstitial fluid, but they just keep extinct from the blood. It's more efficient because it's just the transport fluid. It's not also the interstitial fluid. And here's a comparison of two different invertebrates, one with an open circulatory system, one with a closed circulatory system. So here is our grasshopper, and around its organs are this hemocoel, and this is its long tubular heart, and it's got these little vessels here coming out of its long tubular heart, and the blood basically gets pumped through and around the hemolymph, it's pumped through and around its hemocoel, and then through through the heart and back out again. These open blood vessels move the hemolymph around the hemocoel, and the heart actually has some pores in it that also take the hemolymph directly into it, and the heart is just sort of circulating stuff around. And that's how it ventilates. It's not that efficient, especially compared to this closed system where there's interstitial fluid outside the blood vessels, that just kind of surrounds the organs. And then the blood goes through the heart, is pumped around through the heart, and there's small branch vessels connected to each organ, and so that all of the oxygenated blood can be delivered to these organs, and then the carbon dioxide can be released into the blood, and then it goes back to the heart. Any question? It's much more efficient.